portion of public health for behavioral science and psychiatry for Falcon Physician Reviews. Next, we're going to talk about child abuse. So annually, there are 3 million reports, and 50% are thought to be confirmed. And actually, even though there are 3 million reports, it's still considered to be a very underreported illness. Approximately 6,000 children per year are killed by their caregivers. It's a large number. And as a doctor, or if you're a nurse or a teacher, you are mandatorily have to report this offense. If not, you can be charged for not reporting it if you do know about it. And what are the different types of abuse? There's physical abuse, there's sexual abuse, there's emotional abuse, and actually the most common abuse in children is neglect. And what that means is basically not feeding them properly, not giving them emotional attention, not taking care of them. Neglect, though, is the most common cause of abuse, and it is a reportable abuse. Again, like we said, failing to report child abuse is a criminal offense. And if you suspect child abuse, you're not completely sure, but maybe there is, you will not be held in error if you report in good conscience. If you think you have enough documentation to report that there's child abuse and there's not, there will be nothing will be done to you. Physicians must first protect the child from abuse by separating the child from the parent. So again, on your exam, another high-yield question will be, a patient comes in who appears to have been abused. What is the first thing that you will do? And the first thing they'll give you is do a complete X-ray of their entire body, and then at the very end it'll be E, remove the child from the parent, and E will be the correct answer. So make sure that you always remember to remove the child first. So what are the risk factors for child abusers? These are people who have probably high on something, so they're abusing something like alcohol, cocaine. These people live by themselves, they're socially isolated, and most of the time these people have been abused as a child. And how about children? How are they at risk? Generally, children that are younger than 1 year old, stepchildren, premature children, hyperactive children, and children who have some kind of a neurological or a medical problem, some kind of a developmental delay. These kids are at the increased risk of being abused. What are some signs of physical abuse? Again, very high-yield topic for a USMLE. First, you'll have belt marks, fractures at various stages of healing. That's a big key one. Spiral fractures, fractures in young children, bruises in unusual areas, burns in unusual areas. For example, if you find a burn on the buttocks, most likely a child is not going to be sitting on the stove. So it's usually if a parent gets angry and puts a child on the stove as a punishment. Cigarette burns. Burns generally are the most indicative of significant problems. So children are at a significantly increased risk of dying at the hands of the abuser if burns are involved. So burns are very, very important to identify and also report. Shaken baby syndrome, another very high-yield topic for the USMLE. This is when you are shaking the baby vigorously in your arms. And this is not just simple playing, twirling the kid around, but this is severe shaking as a punishment or trying to make them stop. What can shaken baby syndrome do to a child? It can cause mental retardation, hearing loss, paralysis, seizures, and death. And on your exam, they will give you a baby with a retinal hemorrhage, a subdural hematoma, increasing head size, and a floppy infant. So very high-yield topic for USMLE. So what happens to these children after they've been abused? Well, they tend to be more aggressive to others, and they believe aggression can solve their problems. Parents, when we become aggressive towards children, or we don't know how to handle when kids get out of control and we use aggression, kids will learn that, oh, okay, when someone gets aggressive or when someone does something I don't want to, I have to use aggression to get them to do what I want to do because that's what's been modeled by their parents. So that explains why they become more aggressive and why they think aggression can solve their problems. They don't do well in school, they'll use drugs and alcohol, and frequently, but not always, they become abusers themselves. So when are you going to suspect child abuse in a child. They won't come out and tell you usually because they're fearful of what their abuser will do. So if you notice a child who is engaging in inappropriate sexual activity that is not appropriate for their development, you might want to start asking around, kind of asking the child if anyone's touched him inappropriately, asking them in very gentle ways. You might consider doing an exam. If a 9 or 10-year-old comes in with a sexually transmitted disease, well, that will give you a big hint as something's going wrong. A young child that's having recurrent urinary tract infections and there is no anatomic abnormalities. Any trauma to the anus or vaginal area. And also consider the psychological trauma, the shame, the guilt, and fear if they were to let you know who the perpetrator is. So what's the most important thing that you can do to prevent child abuse is let the child know from a young age what is appropriate touching, what's inappropriate touching. Let them know that they can say no and help them talk about these issues if there is possible abuse. So what's the most important thing that you can do to prevent child abuse is let the child know from a young age what is appropriate touching, what's inappropriate touching. Let them know that they can say no and help them talk about these issues if there is possible abuse. Next we'll go on to rape. So vaginal penetration constitutes rape, and it is a crime of violence, it is not sex. So who are rapists? What kind of constitutes rapists? Well, they generally are 25 or younger, not always, usually known to the victim, usually the same race as the victim, and a lot of times alcohol or drugs are usually involved with both the rapist and the victim. And who are the victims? Again, they're also generally pretty young, below the age of 24, usually raped in their own place of living, and they don't have to actively resist to prove that it's rape. I mean, if someone is saying, I'm going to kill you if you scream, or I'm going to kill you if you're not going to move, and they just don't say anything and do anything, that does not mean that they were not raped. And they may or may not have vaginal injuries. What is statutory rape is having sex with a minor under the age of 16 or 18, depending on the state, and also having sex with someone who is mentally or physically handicapped without their permission. Physicians should be very supportive with rape victims. They should do a detailed physical exam in the presence of a chaperone and or a rape crisis counselor. They should use a rape kit, treat for STDs, treat for emergent contraception, provide crisis intervention, and also encourage the victim to call the police. You cannot force them to, but you can encourage them to. Next we come to elder abuse. Again, this is a mandatory reportable offense. There is a prevalence of about 5 to 10%. It's not important for your exam, but just a number for you to know. And the caretaker is the most frequent abuser, and that is the high yield point for you on your exam, that the caretaker is the one that frequently does elder abuse. There are different types. Again, the physical, psychological, financial, or neglect. Frequently, a person will take in their elderly family member because they know they're getting a check, and they won't take care of them, they won't feed them properly, won't bathe them properly, but they will enjoy the financial means. Next we'll go to domestic abuse. This is not a reportable offense, and about 4 to 6 million women are physically abused per year, and 1,500 women are killed by their abusers. And the abusers are typically male, who are history of impulsivity, poor anger control, and actually these men have very poor self-esteem. And the victims generally tend to stay with these men because they are financially or emotionally dependent with them with low self-esteem. So why does the victim stay with the abuser? She has nowhere else to go. She is dependent on them for finances. And also she's scared because he says that if you leave, I will find you and I will kill you. So what is an abuse cycle? So first, the abuser is built up of stress and tension. He first then begins to verbally abuse her, then physically, and then he apologizes and says, oh, I'll never do it again, and then the cycle repeats itself. Pregnancy is actually an increased time for abuse, and generally the abuser will hit them in the chest or the abdomen. And now we'll go on to talking about smoking. It's the #1 preventable cause of death. So that's a very high yield point for your exam. On your exam, if they ask a question about what could have prevented this man's death, or if anywhere you see the choice for smoking, most likely the answer is going to be smoking. It causes about 400,000 deaths per year, and 45 million Americans smoke. So smoking is a major risk factor for lung cancer, but other risk factors for lung cancer include radiation, occupational hazards, and pollution. Cardiac disease risk factors, again you can see smoking there, but age, male, high blood pressure, hyperlipidemia, obesity, family history, all of these are major cardiac risk factors. I don't expect you to memorize these. They're pretty obvious. These are things that we've learned. But again, remember, if you see smoking, choose it. Cerebrovascular disease risk factors, smoking, high blood pressure, diabetes, heart disease, oral contraceptive use, breast cancer, increased age, family history, early menarche, later age of pregnancy, and the role of oral contraceptives is still unclear. Colorectal cancer, we worry about a low-fiber diet and high fat. Alcohol is a problem. Constipation should be treated. And cervical cancer risk factors include multiple sex partners and the human papillomavirus, or the HPV virus. And another high-yield question for you is that the types of skin cancers in the United States, the #1 skin cancer is basal cell cancer, but melanomas cause more cancer deaths due to skin cancer than basal cell cancer. So those are two important points that you should know about skin cancer. This concludes our section on public health for behavioral science and psychiatry for Falcon Physician Reviews. This concludes our section on public health for behavioral science and psychiatry for Falcon Physician Reviews. This concludes our section on public health for behavioral science and psychiatry for Falcon Physician Reviews. This concludes our section on public health for behavioral science and psychiatry for Falcon